Good morning. Good morning, everyone. Let's start our lecture today. What are we going to do today? Do you know that? I told you last week. What are we going to do? I have already shared with you all about quantitative research plan of quantitative studies. I have nothing new to share with you. So what are we going to do today? To do exercise with you. And the topics is internal validity and external validity. That is the last topic I shared with you last week. So it also serves as a revision. I think you need to start doing revision. I hope doing revision with you week by week, it can facilitate you to prepare for your exam, for your final test. By the way, registry have confirmed all the schedules of the test. Do you know that? Do you know when we will have the final test for this course? Oh, you haven't known yet? I can share with you. Oh, by the way, I'm not sure if it is confirmed or not. Is it confirmed? It should be. But I have already uploaded in Blackboard. Course information. The test, 28 April, Monday, afternoon, 2 hours, 2:30 to 4:30. And test will be conducted in hall, KPC hall. So make sure you go there. For management and nursing students, we will have we will do the test together. We will do the test together. Of course, the test paper are different because I need to pitch at the individual program requirements. So the test paper are different. I will talk about the test. I will talk about the syllabus of the test, the format, all this in my lecture next week, not today. Not today, okay? Okay, today I will do exercise with you. Through doing the exercise, I will keep on revising all the concepts starting from week 4. I talked to you about study design till last week, internal and external validity. In Blackboard, I have uploaded this PowerPoint in Blackboard. And also 2 research papers that I used to illustrate the concepts to you. So the first one, this one. It is not new to you because I used the same paper in the week, should be last week, about critiquing a qualitative research paper, a quasi-experimental research paper. It is the same paper. But of course, the question I'm going to ask you today is different. And then another paper I used to illustrate the concepts of validity is this one, pain management in cancer patients using mobile apps. Okay, I will go through these 2 papers and go through how we identify the internal and external validity with you. Let's talk about this paper first, pain management in cancer patient. This paper, I extract the abstract here for ease of reading. And the title is Pain Management in Cancer Patients Using a Mobile App, Study Design of a Randomized Control Trial. And then the abstract, about 300 words. So I want you to spend a few minutes to read the abstracts and then tell me what are the PICO in this paper. PICO is a really simple and fundamental concepts you must know. So spare 2 minutes. I give you 2 minutes only. Read fast. For the abstract, I want you to read starting from objective. You can skip background. You can skip background, starting from objective and methods. I think you have finished reading it, right? So can you let me know the PICO for this paper? P stands for the population. What is the population this time? Patient with cancer pain, cancer pain patient. Straightforward. How about intervention? I. Where can you find the information? Yeah, from the objective or in the method section, you can identify the same information. Intervention is multi-dimensional mobile phone-based pain management application, in short, EPAL. How about PIC comparison intervention? The current practice, what is it? Usual care, where can you find this information? In the method, which line? Line 3, yeah. The study will be implemented as a two-arm mean two study group, randomized control trial with 110 adult patients with CP cancer pain who own a mobile phone over a follow-up period of 2 months. Participants will be randomized to either the intervention group receiving EPAL, that is the mobile apps, and usual care, or to a control group receiving usual care only. Yeah, so C is usual care. How about outcomes? Many. So if the authors interested in more than one outcomes, they must identify one or two as a primary outcome. Primary outcome means the outcome that I want the intervention to improve most. In these studies, after the cancer patient receiving the EPAL, they expect which aspects, which health outcomes improve most. In the method, they mention it. In method, the brief pain inventory will be used to assess our primary outcome. Line 3, the second half of line 3, the brief pain inventory will be used to assess our primary outcome, which is pain intensity. The primary outcome is pain intensity. That means after the intervention, after the EPAL, they expect the pain intensity will improve most. And also, it is their main aim, main purpose of developing the EPALs because they want the cancer patients to have a lower pain intensity. Apart from the primary outcome, they have lots of secondary outcome, that is health outcomes associated with cancer, such as hospital utilization due to pain crisis, quality of life, adherence to analgesics medication, barrier to pain control, anxiety and engagement. So they have many outcomes here. So remember, when you have many outcomes want to achieve in your studies, you must identify one or two as a primary outcome. So through the abstracts, you know the basic design of the studies, including how many groups, whether it is a randomized control trial, a PICO, the outcome, and also the data collections. And from this, from the method in the first two lines, you don't know how many measurement points the authors have, the study have, but at least you know it must be more than one, because they must have a pre-intervention. That is, before the intervention, they do one measurement as a baseline measures, and then after that, usually they will have another. At least by the end of the studies, they have another. And for this one, they have a follow-up period of 2 months. It means that after the intervention, they have a second measurement, and then after 2 months of completions of the intervention, they do another measurement, because they want to know whether the effect of the intervention still there after 2 months. Okay, let's go through each threats to internal validity one by one. By the way, do you still remember how many factors I have went through with you last time related to internal validity? How many? Is it 6, 7? We can go back to that. We can go back to that lecture. I have one slide summarize all the factors affecting the internal and external validity. That is this one, slide 4. History effect, maturation effect, selection bias, statistical regression, modality, instrumentation testing, testing effect 1, 2, 3, 4, 5, 6, 7. There are 7 factors that potentially affecting a study's internal validity. By the way, do you still remember what internal validity means? What does internal validity means? About the accuracy of the findings in your studies. Accuracy of the findings in your studies, in your study setting. In my study setting, I only have 100 subjects, for example, and it is in 2 primary school only at Tin Shui Wai. It is my setting. Okay. For external validity, I mentioned 時地人. The treatment interact with the subjects, setting, and history out of your study setting. Okay, out of that 100 children, out of those 2 primary school at Tin Shui Wai, still effective? Yeah, this is external validity. So you need to remember the 7 factors that affect, that may compromise the internal validity of the studies, and also the 3 factors, 時地人. And I mentioned to you, subject is the most critical factor that will affect the external validity of the studies. Okay, history. Do you remember what history means? Make sure you know the meaning of each of these 7 factors. Otherwise, you won't be able to identify them correctly from the paper, right? So what is history effect? Do you still remember history? How history affects a study's internal validity? 點解佢會令到佢唔準確啊？令到啲 findings history 咩意思啊？ History is not about memory. History. When we do a studies, yeah, I will launch an intervention in the coming 3 months. Okay, in a primary school. Yeah, similar, something similar to, for example, I'm going to launch an intervention about addiction, about internet addiction in the coming 3 months at TWC, and you are my subjects. But unfortunately, at the same time, the SAO is also organizing something similar to all TWC students. Nursing student, you also part of TWC students. That means when you enrolled in my program, you are at the same time being exposed to the promotion, to the program organized by SAO, right? So you are in fact exposing to 2 programs with similar effects. It is history. That means when I roll out my intervention, and at the same time there is something similar also being given to my subjects. So I cannot isolate with the isolated effect of my intervention on my subjects if I only have one group. 明唔明啊？如果我得一組人，我知唔知道究竟邊個 SAO 嗰個有效定我嗰個有效啊？你哋同時間 receive 緊兩個 program 喎，係嘛 ？isolate 唔到啦，係一個 combine effect 嚟噶嘛。呢個就係叫 history 咯。history 就係話同時間喺個其他同時間發生嘅嘢，喺你 launch 緊你嘅 intervention 嘅時候嚇。Okay, from this paper. So when we read a paper, how do we know there is a history effect? Based on the pain management papers, the EPAL paper, when you want to look for whether there are any history effects, you need to go to the intervention section. So in this paper, you go to page 6. Let me find that paper out. Yeah. Page 6, intervention. You go to intervention, you will know why we go to intervention section when we want to look for if there are any history effects, because in the intervention section, the authors will describe what programs or what therapies the subjects received. So there you can see whether there are any other intervention that the subjects are receiving. And one more thing is, of course, the authors may not be able to identify all the similar programs that may affect the subjects at the same time. But what we can guess is from the description is how long is the program. If the program lasts for a very long period of time, more than a month, then it is likely that there are other things come across within this period that may affect the subjects. So in this paper, page 6, I highlight the answers here. For the two papers, I highlight the answers here to facilitate your revision. In the intervention group, what the author described. Participants in intervention group will continue to receive medical care from their oncologists, palliative care providers, primary care physicians, and other care team. In addition to the usual medical care, they will be able to use the mobile apps EPAL to manage their pain. Okay, here it's very obvious. Subjects in the intervention group is not solely using the mobile apps to learn about pain management. They can also receive any advice, any treatment from the medical teams, from the medical care that they are used to receive. So it is what I mean history. While I'm launching the intervention EPAL, the subjects is also exposed to the usual medical care. And the usual medical care, of course, will be able to reduce the primary outcome, that is the pain intensity. Okay, so in these studies, it has a history effect because the subjects is also allowed to receive the usual medical care. So in my slide here, I say yes, there is a history effect here. And I also extract that short paragraphs here. And in the bracket, the page number of the article to facilitate you to refer to that paragraphs. Then the next question is, whenever we identify factors that will affect the internal validities of the findings, the next questions you need to ask yourself is, did the authors or did you try to control this effect? We cannot eliminate all the effects, okay? But we can try to control it as much as we can. So the next question you need to ask yourself, did the author try to control this effect? And the answer is yes. Why? You tell me. How? How they control the effect? They have a control group. They have a control group. Do you still remember the slide I showed you last time? I have a diagram with two groups. The first group receiving two programs related to smartphone addiction, and the control group only one program. And when you compare the post-test score, you can eliminate, you can isolate the intervention effect once you compare the post-test score of the intervention group with the control group. So that's why I say yes here. And for the reason, you put it down yourself, having a control group can help to eliminate the history effect. So it is simple. It is nothing difficult. It is nothing difficult. As long as you understand the meaning of history effect and you know where you find the information. So research is, in fact, is not difficult, very straightforward, very straightforward. But of course, you need to pay. You need to pay. I know for undergraduate students, it is difficult, but I try to simplify everything to make you understand the concepts. Maturation effect. What is maturation effect? Maturation, do you remember? From the terms, you can guess what is maturation. In this paper, the primary outcome is pain intensity, right? The primary outcome is pain intensity. Will pain intensity subject to maturation effect? 會唔會㗎？喺我 lecture 我講過係咩啊 ？Maturation 同有咩有關啊？嗰啲 health outcomes， 就算你唔俾任何 treatment 佢自己自動都會變好嘅，或者自動都會進步嗰啲係咩嚟㗎？ Last time I give you example for study in children, especially in young children, they grow very fast. And the example I give you is about their motor skills. Even though you don't give them any programs about motor skills development, they grow every day. Their fine motor, gross motor skills grow every day. Yeah, this is one example of maturation effect. If you focus on outcome, that will grow naturally even without any intervention, then that study likely suffer from the maturation effect. And in these studies, I say yes, because the primary outcome is pain intensity. And those patients are cancer patients. They suffer from, for pain, we have acute pain and chronic pain. And for cancer patients, they suffer from chronic pain. And for that patient, they suffer from chronic pain. They will gradually, their pain sensation will desensitize. What does it mean? It means that even though you didn't give them any intervention, their pain intensity will be more or less at a plateau level. So if we know that the pain will, the chronic pain intensity will plateau at a certain level, then it means that even without the intervention, and then I do the measurement, there may be some, their pain intensity may lower. Okay, so that's why I say there is a maturation effect in these studies. And the reason is the primary outcome is pain intensity. Where can you identify the primary outcome in this paper? Here. This is about intervention. Usually after intervention, the author will present the outcome, the section about outcome. So here, they highlight primary outcome and secondary outcome. And primary outcome is pain intensity. Did the author try to control the effect? Yes. What did they do? Yeah, again, control group, the reason. Control group is a universal strategies that can help us to minimize majorities of the factors that may compromise the internal validity. Next, selection bias. What is selection bias? What is selection bias? Do you still remember what is selection bias? It is related to the background characteristics of the subjects in the study groups. So what I mean background characteristics? I mentioned repeatedly, background characteristics is the demographic characteristics of the subject, and it is the biggest confounders. So what I mean selection bias here is if the two groups, there were two groups here, intervention group and control group. If the background characteristics of these two groups of subjects are different, it is possible that some of the demographic characteristics may have a positive or negative effect on pain intensity. So when you do analysis, you don't know whether the change in the pain intensity is due to your intervention or due to the difference in the demographic characteristics. So that's why we concerned most about the demographic characteristics between the two groups. Because again, we cannot isolate the effect of demographic characteristics on the pain intensity, on the outcome. So you see all the strategies, all the measures that we're trying to do is to make sure the subjects in our studies receive only our intervention. So at the end, after completing the studies, the effect on the outcomes is solely due to the intervention we propose, but not other factors, but not due to other program being run at the same time, or not due to the individual characteristics of the subjects. So for this one, selection bias, does this paper has any selection bias? I say not likely or no. Why? Because for this paper, it is a protocol. What does protocol means? Protocol means it's a proposal only. The authors only present their proposal to the readers without result, no result. Some journal articles focus on publishing protocols. Why? Why they need to publish protocol? Because usually for randomized control trial, we will publish protocol because we want other scholars interested in the same area can have an exchange about the research ideas. So we publish protocol. So you can see in the abstract, did they tell the result? No, the study is still in progress. We hope to have results by the end of 2015. So no result here. So that's why I say not likely or no, because I cannot examine the findings. If the paper with result, we can go to the results sections. For my project groups, I have already taught you how to identify difference. I also in lecture, I also do so, how to identify difference in demographic characteristics. Do you still remember where you can find the demographic tables and how to identify the characteristics? Do you know where you can find the table? Which section in the paper you can find the demographic table? In the result section, usually the first table. The second paper I will show you. For this paper I can't because they don't have result. But for the second paper, they have it has result. I can show you that table. Usually, if you want to answer questions like this, you go to the result section. You read the first table. It will say comparisons of demographic characteristics between study groups, and then we read the p-values there. If the p-values less than 0.05, 細過0.05, it means what? There is a significant difference in that demographic characteristics between intervention groups and control group. Do we want to have a significant difference? No, for demographics, we don't. How about outcome? If it is about your outcome, yes, we want to have a significant difference. We want to have a significant difference. So here I say not likely, no. In this paper, because this is the protocol only, I cannot identify the result. And in the box here, I asked you a question, when can you confirm that it is no? I don't read it here because it's just what I elaborate, explain it to you. You can go to the results section and find it out. I say not likely because it is a randomized controlled trial. And in the protocol, they describe the randomization process in details. So if the authors did the randomization process properly, likely the result, the demographic characteristics between groups will have no significant difference. So that's why I quote the second sentence here. So you can go to page 8, randomization. You can find, maybe I show you. Go to page 8. It has the section randomization. You see, randomization. They describe the procedure in detail. Computer program will be used to randomize subjects into intervention group and control group in a ratio of 1:1 using random permuted blocks to optimize balance in each treatment. You don't need to know what are they, but you need to be able to identify this section, and you know they are talking about random allocation. It is what you need to know. Okay, you need to know this paragraph under randomizations is about random allocation. Okay. Okay, statistical regression. What is it? Statistical regression. What is it? 咩嚟㗎 statistical regression 咩嚟㗎 Everything go to the extreme will eventually back to normal. Yeah. 所有咧去最 extreme 嘅嘢咧，最終都會咩啊？回歸翻正常嘅嚇，就係呢個 statistical regression effect. So where do we? How can we identify this effect? I say yes or likely. So first, because it is a protocol, we can't see the result. You need to read the sampling, the selection criteria. We need to read the selection criteria. In this paper, we go to page 3 about the inclusion criteria. Inclusion criteria. So how the research team select subjects? Because in these studies, it is about pain, right? So one of the inclusion criteria is the pain intensity. So I highlight that sentence. Patient inclusion criteria. Patient age 18 or older with diagnosis of a solid organ cancer. And you see the pain intensity. Moderate to severe pain at enrollment, at least 4. Okay, that means did the author try to stratify moderate and severe pain? What I mean stratify is, did they try to limit the numbers of subjects in moderate group and severe group? No, they didn't. When the subject have the pain intensity at 4 or above, then they fit the inclusion criteria. So what would be the possible, what would happen if I just have a cutoff at 4 or above, then you fit the criteria, you come. Possibly at the end, there are several possibilities. At the end, all with an extreme pain intensity, 8, 9, 10, or all at the moderate level, 4, 5, 6. Okay, if all go to the extreme, that is 8, 9, or all 10, then it will suffer from the statistical regression effects. So here, I cannot say yes, but I can say likely, because of the criteria. They didn't separate, they didn't limit the numbers of subjects in the moderate group, numbers of subjects in the severe group. They just have one cutoff, 4 or above. You fit the criteria, you come. So that's why it is possible. After the data collection, all the subjects suffer from severe cancer pain. And so it will result in the statistical regression effect. So I say yes, likely. And the questions here I ask you, when can you confirm that it is yes? 我哋幾時先知道佢有冇個 statistical regression effect? It is a protocol only. If we can read the results, then we can identify the pain level among the subjects. then we will know whether these studies will suffer from the statistical regression effects or not. So here I highlight the sentence in the inclusion criteria. That is the section I just showed you. Moderate to severe levels of pain with a cutoff only, without limiting, without stratify this, the severe and also the moderate group. That is without limiting the numbers of subjects in the moderate and the severe group. So did the author try to control this effect? Yes, they have, because they have a control group. They have a universal strategies here. And a better way to do is they can just say just what I mentioned. They try to limit the number in the moderate and numbers of subjects in the severe groups. Then it is a better strategies. But they didn't do so here. Mortality. Mortality means attrition, withdrawal, dropouts, attrition, withdrawal, dropouts, or related to the mortality effects. That means, for example, I need 100 subjects. At the end, only 18 remain in my studies. So it is a disaster to me because I don't have enough subjects to ensure the power that I want to attain. This is 80%. So that's why. So usually when we calculate the sample size, we don't just calculate the minimum. We don't just finish this calculation after inputting all the numbers into the G power. What will we do next after we get a minimum number? We will add a certain percentage to the subjects, to the sample size. And why we need to do so? Because we want to minimize the potential effect of mortality to our studies validity, In these studies, I say can't tell because I don't know. Because I don't know whether, because I can't see the dropouts. So I say I can't tell. I can't see the dropouts. So it is a protocol only. I can't see the implementation. I don't know. They don't have a chart to show me how many at the beginning and how many remained at the end. But did the author try to minimize this effect proactively? They did. You go to the sample size estimation section, page 8, you will see. Sample size calculation. I highlight here the proactive measures that the author had done to minimize the mortality effects. After the calculations, they did some calculations to calculate the minimum sample size. And then considering a dropout rate of 20%, the sample size goes to 110. So this 110 has already considered 20% potential dropout. So each group have 55 subjects. Instrumentation effects. What is it? Instrumentation. What is it? 咩叫 instrumentation 啊？其實睇隻字都知道講咩㗎啦，大概係咩 ？Instrument。關於 我講一講 instrument 就我哋諗乜嘢啊？要一講 instrument 要諗乜嘢啊？諗乜嘢要？有咩諗啊？一講 instrument 有咩要諗啊？嚇！你攞住個 BB 機喺個病房度量血壓，你有咩諗啊？個病人嘅血壓出嚟得70同30，你有咩諗啊？但係佢精神奕奕嘅喎，醒飯喺度仲係咯，部機嘅問題咯嚇。一講 instrument， 即係所以咧 instrumentation 咧就唔係淨係講咧 research 嘅喎。你做緊 clinical practice 咧，你用好多機器嘅，嗰啲都 instrumentation effects 啊。70、30醒飯喎，係嘛？幾精神出院咯喎，準備係咪？咁好明顯就唔係啦。咁係邊個有問題啊？個機有問題，一係你綁得衰，一係個人問題，個 rater 嘅問題。呢個就係個 rater 個 outcome assessor 問題，定係個機嘅問題咧？咁你要問下自己啦。咁咧係啦，咁所以咧 instrumentation is about the accuracy And also, we use the term validity and reliabilities of the instrument. Simply speaking, whether the reading measured by the instruments is correct or not. So about validity and reliability. So in research, we have ways to check. I share with you in the lecture about the psychometric properties, the test, the validities and reliability tests that we can that we probably see in research paper that describe the accuracies of instruments. Okay, and then another things we need to consider when talk about instrumentation is the way, because for interventional studies, we usually collect data more than once, at least 2, before intervention, after intervention, sometimes 3, sometimes 4. So the second questions you need to ask yourself, did the author using the same instrument in the same format to collect the data at each time point, same instrument, same format, to collect the data at each time point? This is the 2 questions we need to ask yourself. The accuracy, that's the psychometric properties of the instrument used by the authors. And the second question is, did the authors use the same instrument in the same format at each time point? And here I say yes, that's it. I say yes means have an instrumentation effect, has an instrumentation effect that may affect the internal validity. So first, on page 7, under data collection, they say data will be collected at various time points. Baseline, week 2, 4, 8, 9, have 2, 4, 6, 8, have 5 time points. Data collection for weeks 2 and 6 will be via the IVR system, while baseline, midpoint, closeout visit will be conducted in person. However, if for unavoidable reason, in-person visits are not possible, survey questionnaires will be sent via REDCap. So from here, how many format at least? How many formats they have you at least? IVR system, in-person, REDCap, at least 3. So it means that the format, even same instrument, but the format of the instruments are different. Some are online, some through some system, possible, and some in person using hard copies. So the box here I highlight inconsistent mode of administration. Using different system, paper, online administration. I highlight here. So the second question about the psychometric property. How do we know? Where can we find the psychometric properties? Usually in the outcome measures, we can also see the psychometric properties. Yeah, outcome measures here. Pain intensity using the brief pain inventory. Did they mention the psychometric properties? No. How about secondary outcomes? Many secondary outcomes, but they also didn't mention about the psychometric properties. So in such case, I will say, can't tell. In fact, brief pain inventory, BPI, is a very popular and famous scale for measuring the pain intensity. So sometimes the researchers may not put down the psychometric properties there. But for all the other secondary outcomes, they should do so because the scale is not as popular as the BPI, the brief pain inventory, but they didn't do so. So that's why I say not mentioned. So it's likely having an instrumentation effect given question 1 about the mode of instrumentation, about the mode of administration, and also the psychometric properties. Did the author try to control the effect? For instrumentation, we cannot rely on control group. We cannot rely on control group. Inaccurate is inaccurate. Even with a control group, also inaccurate. So whether the authors try to control the effects, it depends on how they do the how they administer, how they request the subjects to administer the questionnaire at each time point, and also the psychometric properties. The last one, testing effect. Testing. How does it differ from instrumentation? Testing is not about the accuracy of the instrument itself. It's about what? Yeah, because yeah, you're right. For interventional studies, we have more than one data collections. So the first data collection, the subjects know the questions you want or know the test you want them to do, you want them to achieve. Then they may have concepts about that test, so they do it. They do it another in the next time point. They may do better or worse. Okay, they may do better or worse. So it is testing effect. It is unlikely to eliminate the testing effect because we must have more than one time point measurements because we need to compare the effect of the interventions before and after. So yes, having a testing effect. Because how do we know it? Because on page 3, we find that there is pretest there. Page 3. We go to page 3. Yeah. Here. It tells the BPI, and after enrollment, they will do the BPI, and then the mid-visit, and then the BPI, and then the close-out visit. So you can see there is more than one time point. So did the author try to control this effect? Yes, it can be controlled by having a control group because both groups suffer the same effect. It is nothing about the accuracies of the instrument this time. It's about the effect of the subjects being exposed to the questionnaire the first time, and they know you want them to achieve this, so they do better next time. Even without the intervention, they will try to do that. So having a control group can help to isolate the intervention effects without being polluted by the testing effect. Okay, that is the first paper. Let's continue to the next paper, Online Dialectical Behavioral Therapy, DBT, for adults with internet addiction. This time is a full research paper. What I mean full research paper is with results, not just a protocol. So you can see more things, you can answer more, you can give more concrete answer on the threats to, on the 7 threats to internal validity. It is a quasi-experimental study. So now, do I need to go through the PICO with you here? I don't think so, because you have done so in seminar, right? You have done so in seminar. So I think I don't need to do so. Just want to refresh your memory about this paper. It is a quasi-experimental studies. What is quasi-experimental studies? Revision again. What is quasi-experimental study? How does it differ from RCT? The major core difference between RCT and quasi-experimental studies is quasi-experimental studies does not have randomization. They do not have random allocation. Can quasi-experimental study have a control group? Yes, they can have a control group, but some only one group, and a better one with 2 groups or more. Does quasi-experimental studies have proposed intervention, that is manipulation? Yes, they have. They have an intervention. The authors propose an intervention. They want to try on the subjects. They want to compare their proposed interventions with the control, maybe possibly the usual care, to see which one have a better effect on the outcome. So the only difference between quasi and RCT is quasi-experimental studies has no randomization. And in these studies, the intervention is DBT for internet addictions. And the control group, they receive CBT. CBT is a conventional psychotherapy for all addiction, for all kinds of addiction, including substance-related or behavioral addiction. So they compare with CBT. CBT like a gold standard now in clinical practice. Whenever a person with behavioral problems, including addiction, they first receive the cognitive behavioral therapy by clinical psychiatrists or psychologists. So the DBT is a new intervention based on a new theory. So they try to compare DBT with the gold standard CBT. Okay, history effect. History effect. Can you tell me, is there any history effect? Even though I say yes, can you identify it from the paper? In fact, I highlight the paragraph to you here. Can you read the highlights and then tell me why I say yes? Even though you know the answers, you need to explain to me why. I highlight the answer here. But why I highlight the answer here? 我要你解釋啦，我做啫，我做你今日係啊，咁梗係係啦。咁點解係啊？而家到我問你啦，調翻轉，點解係啊？你唔好同我 highlight 住，你又話係喎。雖然我俾埋你，咁點解係啊？嗱，你解釋到咧，你就識晒㗎啦，考試。我 highlight 住啲咩啊？20 participants in the experimental group were randomly assigned to 4 groups. Experimental group 咧有20個人喎，嗰20個人喺個 experimental group 裏面咧都要 randomly assign 去 4 group， 即係話咧嗰20個人仲要分開4個 subgroup 喎嚇。佢做乜嘢啊？每個 group 有5個人，每個 group 咧就做一個8個 week 嘅乜嘢啊 ？online DBT 嘅 therapy with 1 week interval， 即係其實咧嗰8個星期裏面咧佢係隔個星期要做嘅啫，即係其實做4次嘅啫 online 嚇。咁呢個點解我話佢有機會有個 history effect 啊？係啊，每個 group 都有90分鐘啦，係啊，呢個係每個 section 嘅，即係佢4個有4次，每次90分鐘，咁90分鐘又點咧 ？OK， 正常差唔多1個鐘90分鐘2個鐘頭嘅 therapy OK 噶。但個問題係咩啊？我嚟一次就 OK 啫，係咪？嚟多幾次咧？除非你覺得自己好有需要，真係嘅喎。除非你覺得好有需要嘅啫，如果唔係點啊？又唔得閒啊，又約個 friend 啊，一陣間又話要做工啊，咁樣就唔嚟㗎啦，係咪？係咪啊？咁呢啲咧就係你呢一場，佢幾耐㗎？即係2個月嘅喎 ，8 weeks 2 months 嚇。一耐咧就會有呢啲，即係有呢啲問題啦。咁同埋咧，嗱呢個係講 drop out 啫。我想講咧8個 week 咧，喺呢8個 week 裏邊，佢會 receive 緊其他嘢咧，同時間有機會啊，係嘛？有機會喎。所以我哋唔能夠完全排除咧佢冇嘅 history effect。你可以問喂 Anson 啊，佢都冇 receive 其他 therapy。佢都冇寫，你知唔知佢？你肯定佢冇？唔肯定噶嘛，係嘛？佢自己走去睇書得唔得啊？上完第一堂，哇！你嘅 DBT 咁好㗎，我又自己去揾下啲嘢睇下先。會喎，有啲好學啲，咁唔好學嗰啲就唔好講啦，係咪？咁你就有機會。咁所以 history effect 咧，基本上個呢啲 studies 咧都會有嘅，都會有啲 history effect。So that's why I say yes here。你要自己解釋到喎，唔係我解釋喎，你要講到喎。知唔知係你講到，唔係我講到。考試我唔係做晒你100幾份卷啊，同你有153個同學我唔會做晒153份卷嘅，我哋係出卷嘅啫。Okay, did the author try to control the effect? Simple, straightforward. Have a control group. Cross experimental study 唔一定有 control group 㗎，得一組㗎嘛，有啲係咪？佢有幾款唔同嘅 design 㗎。One group pre-test, post-test 有啲咧就係 pre-test, post-test with non-equivalent group。佢呢個就係嗰種啦。咩叫 non-equivalent group？ non-equivalent 睇隻字唔同咯，係嘛？唔 equal 啦，乜嘢唔 equal？ In terms of number, in terms of characteristics, in terms of 乜嘢 non-equal unequal, non-equivalent 我講過㗎。In terms of number or in terms of characteristics? In terms of characteristics 全部耷晒個頭，真係啊！點會 in terms of number 咧？唔會 in terms of number。有幾多 sample？ 我哋分咗，但係即係控制唔到剩翻幾多㗎嘛。Non-equivalent 係講緊個 characteristics。點解個 characteristics 係 non-equivalent？ 點解？啱先問完你哋嚟。 點解個 demographic characteristics non-equivalent 啊？點解兩組唔一樣啊？佢冇做到乜嘢啊 ？quasi 佢冇做 randomization 啊嘛，就會咁噶啦，係嘛？就會 likely 會係咁噶啦。即係你睇下碌嚟問咗你哋來去都係問住嗰啲嘢嘅啫。即係話你呢啲係一定要識嘅，所以要翻去温熟佢咯喎。啊，即係問嚟問去嗰啲咧，成日上堂講嚟講去就温熟佢咯，就係翻去。因為你哋完咗呢個 course 係淨係識呢啲嘢嘅啫，淨係夠唔夠啊？夠啦係嘛？使唔使多啲？唔使啦，夠噶啦，夠噶啦。再有興趣讀 master 嘅時候再讀嚇。係畢咗業做下嘢先啦嚇，讀 master。OK，maturation effect。我呢度有冇 maturation effect 啊？我話 no 喎，咁點解 no 咧 ？Page 3，我又 highlight 睇下先 ，Page 3揾翻 Page 3出嚟先。Whenever we talk about maturation effects, you must go to the outcome measures, the outcome measure sections, because it's talk about your outcomes and also the measurement tools. So in these studies, I highlight the maturation effects here and also highlight some related lines, So can you tell me why I say no for maturation effects here? You can find it out on page 3 and page 4. 你話我知點解啊？ What are the outcomes in these studies? How many outcomes in these studies? How many? 你睇啊，而家睇就係佢咧就唔係寫住 outcome measures，佢寫住 psychometric tools，其實即係 outcome measures。你睇下，佢有幾多個 outcome 啊？你而家自己睇，唔好成日淨係我講，要你哋諗下。有兩個，邊兩個 outcomes？ 有兩個，邊兩個 outcomes？ 第一個係乜嘢？第一個 tools 係咩 tools 啊 ？Internet addiction test 佢愛嚟 measure 一個乜嘢 outcome 㗎？佢愛嚟 measure 呢個係第一個 tools 佢寫佢會用啊嘛。Internet addiction test 佢嚟 measure 一個乜嘢嘅 outcomes？ 你睇到㗎咩 outcome 啊？佢嚟 measure internet addiction 咯。佢 measure internet addiction 嘛，攞嚟係咪？呢個第一個 outcomes。第二個咧？第二個呢個2.2.1啦，係咪啊？佢有2.2.2嘅喎。University of Rhode Island Change Assessment Eureka 呢個 scale， 我哋 measure 咩啊 ？Motivation for change 啊，佢有冇第三個啊？我哋 look 下 page 4先，有冇啊？冇咯啊，好在啊兩個啫啊，唔使睇咁多。2.3就係 data analysis， 多啲又要睇多啲又麻煩啊嚇，唔識分。咁啦 ，internet addiction 同 motivations for change 會唔會 suffer from maturation effects 㗎？會唔會日日改變㗎？會唔會好容易變㗎？我講句你唔好玩，你唔好上網啦，跟住你以後唔睇遊戲機，唔上網會唔會啊？唔會啊嘛，係咪 ？Motivation for change， 而家一個人 change 佢個 behaviour 咧，你係好耐嘅事嚟嘅喎，係咪啊？我上完個堂，你會唔會中意咗 research 啊？會唔會即刻走去做 research 啊？唔會啦，係咪？我改唔到你嘅 attitude， 你依然係好 negative 對於 research 呢科，係咪？咁我冇辦法改變你噶嘛，唔係上14個 week 你就會中意咗噶嘛，係咪？係啦，好 negative， 我知道，恐懼添啊，去到唔使 anxious 啊，唔好去到 anxious 嚇，冇咁驚嘅嚇。咁所以咧，呢個咧就唔會 suffer from 嗰個 maturation effects 咯嚇，因為唔係咁容易會變嘅嚇。So that's why I say no here 嚇。They are difficult to change without intervention. Selection bias. I say yes, but the effects could be small 啊。點解我寫啲咁嘅嘢喺度咧？你要揾翻出嚟俾我喎。我話 yes 有。但係咧，個 effect 可能好細嘅。It is a quasi-experimental studies with non-equivalent group。 This is the terms I just mentioned to you. Non-equivalent group 即係乜嘢？講一次俾我聽。因為冇 random allocation 導致咗乜嘢啊 ？Non-equivalent group 唔係解 no random allocation 啊！你哋講嘢嘅時候跟翻個次序唔該。因為咩啊 ？No random allocation， 所以 likely 點啊？嗰兩 group 嘅 demographic characteristics 咧會有唔同。所謂 non-equivalent 即係 unequal 嚇，就係講緊個 demographic characteristics。點解咧嚇？有兩個原因嘅。You can find you can find useful information on page 2 and page 4. We go to page 2 first. Page 2 here. 你睇下呢段佢講乜嘢啊？我 highlight 咗呢段，寫住 selection bias effect。你睇下呢段講乜嘢？你睇完話俾我聽。佢講乜嘢啊？呢度4行5行字。Matching was not achieved as the recruitment process was staggered and initially assumed disproportionality would occur. 冇 matching， 你知咩叫 matching 啊？喺 study 裏面 ，matching 嘅意思咧，嗰兩組人咧，佢哋個 demographic 咧冇 match 到啊！我講 case control 嗰陣時候咧，我仲記得 study design 講 case control， 我輕賴個 matching 呢個字啊。如果 case control study 咧 ，control 嗰個 case control study 咧有個 case group 啦嚇，有個 control group 嘅 control group 我哋叫 match control group。咩叫 match control group 咧？就係話咧 control 裏面啲人啊，嗰個 demographic characteristics 咧要同 case 嗰啲係一樣嘅，嗰啲叫 matching。咁咧呢個概念咧喺 interventional studies 咧都會 apply 嘅。matching 意思就係話，我睇下 intervention 嗰啲人嘅 characteristic 有幾多男幾多女幾多歲 education level whatever。然之後咧 control 嗰啲都要有同等數量嗰一類嘅人喺度，嗰啲叫 matching。But here they didn't do matching because of some reasons。跟住嗰句寫咩啊 ？Nevertheless, the analysis demonstrates non-significant difference in the distribution of sex and age between the two arms。點解佢要 highlight 呢兩句啊 ？Sex, this is gender, age between the two arms, non-significant difference， 即係話啲兩組人嘅 gender 同 age 有冇分別啊？冇分別。點解佢特別要咁講？你知唔知佢？佢唔講第二樣嚇？其他分別又唔係。係啦，尤其 especially gender is the strong associate factor. Male is always found to have a higher risk of having internet-related addiction as compared to female. So that's why they highlight this. How about age? Age the same. Age the same. The younger the age, the higher risk of having the internet-related addictions. 咁佢咁樣好似解釋咗自己冇 selection bias 喎。但係點解我話佢 likely， 但係可能個 effect 都細咧？我哋去 page 4啦。Page 4. This is the table that I say. When you want to know whether there are any selection bias effects, you can go to the results section and read the first table. This table, demographics, you see the words? An internet use variable between control group and intervention group. So the first column is the demographic variables, many, age, sex, residence age, all this. Control group, intervention group, and then this one is the test, the statistical test they use to compare the variable between groups. So they either use the t-test or chi-square. I didn't tell you about chi-square in the data analysis lecture. And the p-values, you must know this column, the last column, p-values less than 0.05 means there is a significant difference for that variables between groups. So the authors highlight age, sex, do not have significant difference between groups because the p-value is greater than 0.05. How about the rest? How about the rest? Any of the demographics here has a significant difference. Residence, no. Age of first internet use, no. Main motives for using internet, yes, because the p-value is 0.007, that is less than 0.05. So I highlight here. How about the rest? Negative consequence from internet use, perceived pathological use, perceived need for professional help, all this, no. Only this factor. Motives for using internet is also an associate factors for is an associate factors of internet related addiction. So that's why I highlight here. So even though age, sex, the strongest factors related to internet addiction has no effect, has no difference, but the motive for using internet has a significant difference. So this difference between groups may possibly affect the outcomes, That's right, I highlight here. Did I mention? I think I did, but just maybe just one or two sentences about how we solve the problems of having significant difference in demographics. If we unfortunately find that some of the demographic variables that are related to the outcome and have a significant difference between groups, we can do something in data analysis to control the effect. If the authors did so, they will mention in the data analysis section. But here they didn't mention about controlling the effects of main motives for using internet. So that's why I say, yes, but the effects could be small because only one factors that are found associated with the risk of internet addiction has a significant difference between group, and the author didn't tell whether they control this factor or not in the data analysis. So that's why I say yes, but with small effect. You don't need to know how to identify that sentence from the data analysis section. No worry about that. I only mention to you lightly because you don't need to know much about it. And I also won't have questions about this in the final test. No worry. But I want you to know more about research, so that's why I share with you. Did the authors try to control the effects? No, because in the data analysis section, they didn't mention anything about controlling the effects of motives for internet use in the paper. Statistical regression effects, any? 有冇啊？呢個 No, this time. Why? Why I say so? Because now this time, in the selection criteria, let me check first. Page 2. In the selection criteria, how they select the subjects? Participants were first screened and for elevate score, moderate and severe on the IAT, internet addiction. 即係話咩啊？If they are at moderate and severe level, they fit the criteria, I will include them in my studies. Okay, severe and moderate, moderate and severe. Any stratify? No stratify again. What I mean stratify is limit the number in moderate and severe internet use. They didn't. So if I can only refer to this sentence, I would say likely for statistical regressions because they didn't limit the numbers of subjects in the moderate and the severe group. But this time I say no because I can read the result. We go to the result section. You go to the result section with a graph like this. How to read this graph? Because this time I talk about the internet addictions only. So I focus on internet addiction. So you can see in this graph, the first point is the pre-test before the intervention. We look at the pre-test. Not the post-test. because we want to know before the intervention whether there are any, how is the internet addiction score. And the circle is the control group, is the internet score for control group. And the triangle is the internet score for the intervention group. Okay, let's look at the control group first. It's about 56, 57. This is 50, 55, 60. So the score is around 56, 57 for control group, the internet addiction score. How about this, the intervention group, DBT? The score is slightly above 50, maybe 53, 53 maybe around. So the control group is 56 around, and the intervention group is 53. So does it belong to moderate or severe group? We don't know. We need to back to the section about outcome measures, then we will know. This is the section talking about how we define moderate and severe for the internet addiction test. So from here, you will see the total IAT score were later categorized into 4 groups to determine the addiction severity. Normal, 0 to 30, mild, 31 to 49, moderate, 50 to 79, severe, 80 to 100. Based on the 2 score we just read from the graph, they belong to the moderate group, right? Because both is around 53, 56. So it's moderate group, not the severe group. That means they don't have severe, they don't have extreme score. They don't have extreme score. So that's why I say no here. That's why I say no. I say no based on 2 evidence. First, the inclusion criteria. If I only have the inclusion criteria, I would say likely. But because I can read the result, I read the score there in the pretest, I can find that it's around 50 something. So it is at the moderate level. So it is not an extreme score. Mortality, about the dropouts. First, the authors did some proactive measures to minimize the effects. We go to page 2. Mortality effect here. Page 2, a long paragraph with much information. The highlight one. The resulting values, they do some calculation. They use G power and inputs the various effect size, the power, and then the alpha to do the sample size calculations. And after that, 28 samples is needed. But after they know that they need 28 samples, what did they do next to minimize the mortality effect? The resulting values of 28 samples calculated from the G power was further corrected to a 30% dropout. They anticipate there will be 30% dropout. So at the end, they need 40 subjects, not just 28, because they add 30% dropouts there. So this one is our proactive measures to prevent the mortality effects. Even though with dropout, if the dropout less than 30%, I can still have more than 28 subjects there. So it will not make the study power drop significantly due to low sample size. So this is the first thing we need to identify. Next, because it has result, we go to the result section to find out this flow chart. Then you will know whether there are dropouts. Okay, this graph. For all interventional studies, they have this flow chart. For all interventional studies, for all research paper with good quality, all research, I need to highlight, research paper with good quality. They have this flow chart because it is a standard reporting. It is a standard reporting for all interventional study. We call it CONSORT. I slightly mentioned about it in the lectures for study design. In this graph, it gives you much information about how the researchers recruit subjects, how many subjects at the beginnings of the studies. Okay, you read the graph for me. At the beginnings of the studies, how many subjects? How many subjects has recruited for these studies? How many? You read the graph for me. How many? How many of them the teams has recruited? How many? 40. How do you know? 30 allocation. Do you see? 30 here. Because in these studies, they recruit subjects 2 times. The first time, 30. How about the next, the second one? 10 only. Okay, so in total, 40. How many subjects in each group? 20 subjects in each group. 20 subjects in each group, I highlight here. So after the allocation, all 20 subjects receive the intervention. Follow-up means at the end of the studies. How many? Any left? Any lost to follow up? No, I highlight 0. Discontinued 0. How about control group? 0, 0. That means that 20 subjects being allocated to either groups received the intervention and remain in the group till the end of the studies. So in the analysis, you can see 20 and none of them being excluded from the analysis because all of them have complete the intervention and also complete the data, complete the measurements. So there is no dropout in this in these studies. So at the end, the total numbers of subjects is 40. Okay, so no dropouts here. So that's why no mortality effect. How about instrumentation? You tell me for the instrumentation. You read these 2 paragraphs again and then tell me any instrumentation effect. You read here. The first, only 2 instruments here because only 2 outcome. Internet addiction test and then the Eureka for the motivation to change. You read the sentence I highlight, you read the lines I highlight and then tell me whether there are any instrumentation effects. You read the lines I highlight for the 2 paragraphs. First, it's about the internet addiction. Second is the Eureka for measuring the motivations for change. When you read the lines, you tell me how's the psychometric properties of these 2 scales? How's the psychometric properties of these 2 scales, these 2 tests? Are they good in terms of validity and reliability? Don't just answer me yes. Don't just answer me good. I need evidence, not a descriptor. For the Eureka, you need to go to page 4. I highlight a few lines, 2 lines here about the psychometric properties here. Okay, for the internet addiction test, how's its psychometric property? How's its reliability and validity? Is it good? Satisfactory? Good. Why? How good is it? The lines I highlight, the Indonesian version of the Internet Addiction Test, IAT, has very good validity. You don't understand all this because it's about the factor analysis. But you can identify it. Even though you don't understand all this number, but you can identify it. How about reliability? High reliability. What reliability test the author has referred to? Combat Java, what is this kind of test? It check which components of reliability. It check which component of reliability. 係啊，我有寫㗎。It check which component, what kind of reliability? What combat alpha check? 啊，佢 check 咩㗎？佢 check 咩㗎？要識喎。Combat alpha 就成日出現㗎啦，喺啲 test 嗰度，喺呢啲咁嘅 research paper。咁佢 check reliability check 咩咧？check 佢嘅 internal consistency。咩叫 internal consistency 啊？一份 paper 呢個唔係呢個 test，Internet Addiction Test 有20條 items 係嘛？呢20條 items 係咪都係 measure 緊 Internet Addiction 啊？呢20條 item 如果都係 measure 緊 Internet Addiction 嘅時候，嗰個 subject 如果佢有 Internet Addiction，係咪嗰20條 item 佢個 rating 應該都係高啊？係咪啊？佢就係睇緊係咪呢樣嘢咯？係咪嗰20個 item 講緊 Internet Addiction 嗰個人都係 rate high 咧嚇？佢有個 rating score 係咪都 similar 咧？會唔會咧有某幾題佢 rate 得好低咧？但係其實都係同佢嘅 Internet Addiction 有關。呢個就係所謂嘅 reliability、consistency 就係咁解。至於嗰20條 question 應唔應該喺呢個 Internet Addiction Test 嗰度咧？應唔應該喺啊？即係話係咪講緊 Internet Addiction 咧？就唔係用 internal consistency 去 check 嘅，係用咩啊 ？content validity 去 check 嘅嚇，所以要分開喎。嗰20條 question 係咪都係講緊 Internet Addiction？ 我哋係 through validity test 去 check 嘅。好啦 ，validity test check 完，佢呢20條 question 係講緊 Internet Addiction 啦。OK， 留低啦可以。Next 就係問自己，如果呢20條 questions 都係講緊 Internet Addiction， 如果嗰個人真係有個 addiction 嘅時候，咁呢20條 question 佢個 rating 應該都係高㗎啦，係咪？或 more or less similar， 唔會突然間有一題低咗㗎嘛，係嘛 ？Internal consistency 就係 check 呢啲嘢㗎啦。如果突然間有條低咗，即係話咩啊？即係話你嗰個 questions 個 items 可能個 description 係令到有人誤會而導致嗰個人佢答咗一個 rating 同佢其他 answer 係唔 consistent 嘅 reliability 我哋就係 check 呢啲嘢啦。Okay, then next you need to be able to differentiate whether the numbers alpha is good or not. 0.8 over 8, is it a good internal consistency score? Greater than 8, is it good? Yeah, it's good 啊，係真喎。總之咧，你記住咧，大過0.8咧，全部都係 good 㗎啦嚇。Test retest 都係嘅，大過0.8咧就係 good 㗎啦。How about the Eureka for measuring motivations for change? The Indonesian versions of Eureka has been validated with good validity, but without mentioning the test, because it has a reference at the end. You can refer to the reference here to check for the validity test that the author has done in 2013. They didn't tell. But how about the reliability? They tell they put down the result of internal consistency again. That's why I say it is the first and most popular reliability test. So that's why you must know Combat Alpha is for testing the internal consistency, and the values greater than 0.8 means good reliability, good internal consistency, because this is really common. Okay, back to here, I say no or unlikely because the psychometric properties is good. And this next point is about the data collection procedures, because I mentioned to you we need to consider two things. First, the psychometric properties. Second is the administration procedures consistent among measurement points. Here I say yes, the same set of questionnaire in the same format was used. In fact, in the paper, it didn't say so. It didn't say so. But if they use different mode to they request the subjects to use different mode or different formats of the questionnaires to fill in different formats of the questionnaires, they will tell, like the previous paper. So here I assume they use the same format of the questionnaires to for each time point. So that's why I say no, unlikely. Testing effect, the last effect, testing effect, yes, because have pre-test and post-test. So this one must be yes. Did the author try to control the effect? Yes, because with a control group. That is internal validity. I hoped through doing these two papers together today, you know more about the meanings of the 7 potential factors affecting the internal validity and know how to identify them from a research paper. At least you know from which section of the paper you can find the information. Last but not the least is about external validity. External validity, 是的人 subject. The characteristics of your subject in your research is strong factors affecting the external validity of your studies. So when you read the paper, how do you judge the external validity of the studies? Usually we refer to 2 sections, the subject recruitment and also the discussion section. We read the subject recruitment section because we want to know how we define the population, and how we recruit the subjects. How we define the population help us to know whether the characteristics of the population you studies is similar to the whole populations. Like again, my studies about primary school children with smartphone addiction, how I define the age. In my studies, I focus on young adolescents, so 10 to 12. I exclude those middle or I exclude those 13 or above. So in my studies, I only focus on young adolescents. That means my findings may not be able to generalize to adolescents 13 or above. Yeah, so you can say how you define your population will affect the external validity. That is the generalizabilities. And then another thing related to subject recruitment is the selection, is the sampling method, how you recruit the subjects. I mentioned to you 2 big categories, probabilities and non-probabilities. If you go for the non-probability approach, likely it will, if you go for the non-probability approach, likely your result will suffer, your generalizability will suffer because quite a numbers of possibly major characteristics in the populations cannot be recruited to your studies. You haven't tested those demographic characteristics. You don't know whether people with those characteristics have a positive effect after receiving your interventions. So it will compromise, affect the external validity. Another section we'll read is discussion, because usually for a good research paper, again, I need to highlight, for a good research paper in the discussion section, after explaining all the results, all this, we will have a limitation section. And in the limitation sections, we will highlight potential factors that affect the internal validity and also the external validity of the study findings. So we go to discussion section. For the first paper, the protocol, I say here it's difficult to assess because no result, but just based on the selection criteria, it may limit to those with moderate and severe pain, but not for mild case, because they have a cutoff, 4 or above, they include, otherwise exclude. So that's why it may not be able to apply the EPALS and with this with the same effect on the mild case. And then another point that was mentioned by the author in the discussion section, page 9. It tells that the study was conducted in an academic medical centers only. So it may not be able to generalize the finding to some non-academic medical centers. They highlight this point here. And this one, and the first point is about the subject, 是地人 is about the subjects. And the second point is about the setting. It's about the setting, 是地人, right? The setting. The difference in setting may also affect the intervention effect. And in these studies, they only conduct the studies in an academic medical centers. 係嗰啲大學嗰啲附屬醫院中心嚇。But how about some non-academic medical centers, some health centers, they don't know. So they highlight this point in the limitation section. For paper 2, that is the one just go through with you about the internet addiction. The target population, the age range is 18 to 40, 18 to 40. But after I read the result, the age range is very narrow. The age range is very narrow. That means the target groups is 18 to 40, but your age, the subjects that recruit in your studies with such a narrow age range, that means some 30 or above, you cannot test on them. So that's why it limits the generalizabilities. So the first is about person. Second, other potential factors that may affect the generalizabilities is competency in technology, because it is an online intervention. The DBT, dialectical behavior therapy, is an online therapy. So when they recruit the subjects, they highlight they need to have access to internet. That is, if the person are not good at technology, they may not be able to use the apps properly. Severities of internet addiction. Again, this is about the person. They exclude mild case. They only focus on moderate and severe case. And in fact, in their studies at the end, all the subjects are at the moderate level, 53, 56. I mean the score, based on the score. That means they didn't test on the severe case as well. So the study findings is only limited to those with moderate internet addiction. So the results may not be able to generalize to mild and severe case. Oh, it is the last slide. I can release you early today. Before you leave, I want to say something about the lecture next week. The lecture next week is the last lecture. I mean, for me. And then after that, Elias will come again. And for this lecture, I call it consolidation because it's a revision lecture. And I told you before, in the revision lecture, I will go through the self-study exercise. There are two. One is MCQ, another is a simple case studies. But I changed my mind. I want you to do it yourself for the self-studies. So I have an answer here. I have answer here. I hope after you do all the revision and then you do this too, self-exercise. The MCQ, how many? Only 30. How many questions here? Only 31. And then for the case studies, it's a short one. You need to read a sample paper and answer these questions. All these questions, again, about study design, about variables. Ask you again, randomization, sampling approach, reliability, because they are all major concepts you must know. So I asked you repeatedly, and I talked to you repeatedly in lecture and also in seminar and also the self-study exercise. So what are we going to do in lecture? I prepare another test for you. We go through all this together. There are over 50 questions here. And and through these 50 questions, it includes all the major concepts that I have shared with you in all my lectures. So I hope the lectures, the consolidation lectures can consolidate what you have learned. And after that, then you go to the self-study exercise to test yourself, to test your own abilities before you go to the final test. Okay, this is the arrangement on the lecture next week. Make sure you have done the self-study exercise before you go to the final test, because this is a great revision for you. It is a great revision for you. Okay, see you again next week.